So, how should health insurance markets work? There are a number of different options and we'll talk about each of them. And these options aren't mutually exclusive. A lot of different countries employ more than one of these. So, you can have completely private insurance markets with no government intervention. You can have universal public insurance, which is something like single payer, compulsory insurance, where it requires everybody to sign up. You can have insurance through an employer, and you can also have means tested insurance, both of which we have in the United States. So we'll talk about how each of these things differ. The option one is private insurance markets. So when you're looking at the Rothschild-Stiglitz model, which is essentially that model that predicts adverse selection, moral hazard, and potentially the death spiral, it predicts that in private insurance markets, only what they call the frail, or people who need that coverage the most, are going to end up being insured fully. And much of the population is going to be underinsured. And that's going to happen because of the way that through adverse selection, people who are the sickest are the only ones who are going to end up wanting to sign up for that more robust full coverage. There are even some conditions under which a completely private market could just totally unravel, where everybody would end up uninsured. The thing about the private market is that it minimizes government involvement, even while it's maximizing adverse selection. So taxpayers can be happy with low tax bills, but a lot of people just won't be able to buy insurance or not good full coverage. They might worry, while they might enjoy or be happy about low tax bills, they might at the same time worry about medical bills that they could rack up if they were to become ill or injured. So that's option one, totally private insurance. It has its pros and cons. Option two is universal public insurance. So under this, the government would provide coverage to all citizens and it would be financed through taxes. It's appealing because it sidesteps the whole issue about adverse selection and how that ends up leading to and underinsurance. It furthers the goal of equity because the poor would pay very little or nothing for coverage because it would be based on taxes. However, you would have to take steps to control moral hazard, which could potentially get really big if the government budget were to be completely left unchecked. So the main cost of public insurance is just the higher taxes, even if it costs less than the private market, and especially for those who end up paying higher taxes, like the highest income households. And also, when you levy a tax, it can distort individuals' behavior. So there are ways in which the economy can become less efficient. So if a person knows that every additional dollar that they make is going to be taxed really heavily, they might be less likely to decide to work the extra hour. That's kind of what that issue is. And so higher taxes are kind of a cost of public insurance or of public programs in general. And that doesn't necessarily mean, overall, it could be that universal public insurance is more efficient, even if it introduces an inefficiency to the highest income households in them making more money. It could be overall efficient if it drastically reduces inefficiencies in other parts of the healthcare markets. And so this is what they call single payer healthcare because one entity, that is the government, is going to be doing all of the paying for the healthcare. Compulsory insurance can be related to universal public insurance, but it's just a legal requirement that everybody enrolls in and purchases private insurance. So it's different from just having universal public coverage where the government is the one that collects all of the money through taxes and pays that out to healthcare providers. With compulsory insurance, you can still have it be universally covered. However, it's happening through the private markets. There's just a legal requirement that everybody enters into that private insurance market. So it addresses adverse selection essentially by banning it. Everyone is going to be required to purchase in, even those healthy consumers, so that helps to spread the risk around. But it's not going to be free for the consumers or for the government. The government still has to go around regulating the market and making sure that everybody is actually following through. They have to enforce that mandate. For a lot of citizens, they won't necessarily be able to afford to buy into that private coverage because it won't be paid for through taxes like it would in a public system. It would just be that everyone's required to buy this product, which is insurance, and some people won't be able to afford it. So often the government will have to supplement this through some kind of subsidy. The mandate is probably not going to be just like implemented by itself without any kind of public support for people who need it. So it has to be really carefully defined. What kind of insurance are people required to purchase? Is it just any insurance, which means it could be really, like thin coverage with really high out-of-pocket maximums and not really good full insurance? Or are you going to require that people get, really full coverage? If you don't specify, then you might end up having a really weak insurance. Option 4 is employer-sponsored insurance markets. We have this in the United States. So employers are, under this kind of system, employers are required or encouraged to offer a private insurance contract to their employees. It helps with adverse selection because everybody who works at the same job is all kind of being pooled together, just because different people are trained to do public health, for example, whenever you move on to your job, doesn't mean you guys have the same risks. So the high risks and the low risks, we're all work at the same place, and you're all pooled together for this insurance pool. That's the benefit of employer-sponsored markets. The drawback is that sometimes, it creates labor market inefficiencies. Not everybody is going to work. Children, retirees, disabled persons. We know that labor markets discriminate, have racial discrimination. So, and also gender-based discrimination, as women tend to take time out of the workforce to have children, more so than their male counterparts. So by tying healthcare to your employment, it's likely that it's going to have, discriminatory impacts on members of the population. So there are definitely drawbacks to allocating healthcare through the employer market. Option 5 is means-tested insurance. That's another thing we do in the United States. We provide subsidized healthcare for low-income households, like with the Medicaid program. So this is about moving towards the equity goal by providing healthcare to people who would otherwise not be able to afford it. The costs are similar to any kind of public health insurance market, which is tax-related inefficiencies and the potential for moral hazard because we're not going to be requiring individuals to buy into that market. And the benefits are the same too, which is further equity and potentially some kinds of efficiencies like labor market efficiencies. So in the next video, we'll talk about other ways of controlling moral hazard.